One of the hottest topics that is no doubt going to be discussed is that the CBO, the Congressional Budget Office, says 15 million people may lose Medicaid coverage. That's more than the number of people who gained it under the Affordable Care Act expansion. Are the numbers accurate? We right now have reaction, breaking news from the man who represents every single state's Medicaid program. Joining us now in a Fox Business exclusive, Matt Salo. He's the National Association of Medicaid Directors Executive Director. First, I will put this question bluntly to you. Is the CBO right or wrong about 15 million people losing Medicaid under the Senate bill?
It's definitely plausible. You simply cannot take $700, $800 billion out of this program and not have a significant amount of human collateral. And that will mean either millions and millions of people losing coverage or millions and millions of people losing access to doctors because we can't pay them enough to see anybody, or dropping coverage of things like prescription drugs. There's no way that the Medicaid provisions in this bill are workable in any way, shape, or form.
I just want to let our viewers know that on the left side of the screen, these are our stakeout cameras, as we're calling them, who have scrambled into place. And what we're doing is we're waiting for any senators, GOP senators, who arrive at the White House. We will get those pictures to you as we continue with Matt Salo. What about the fact that Sarah Huckabee Sanders just said in the press briefing that the CBO is unreliable in its scoring, and it was on certain metrics unreliable in scoring of the ACA or Obamacare?
Well, I mean, they're not Nostradamus. They're not going to make an absolutely perfect prediction, but they are the law of the land in terms of making predictions, and they're looking at this in a nuanced and in a nonpartisan way. But what I can tell you is that when my members look at this, there is an overwhelming consensus. And keep in mind that 2/3 of the states have Republican governors, so 2/3 of my members work for a Republican governor. There's an overwhelming consensus that the per capita caps in this Senate bill are simply insufficient, they are unworkable, and they will lead to very, very harmful things happening in states across the country.
But you can't argue that Obamacare is, as Mitch McConnell put it, unsustainable. And I say that because more than 40 counties in America, and it could be way more than 40 at this point, next year will not have a single choice for insurance coverage for people. So what needs to be done? It's extraordinarily expensive, but again, one could argue that under the Republican plan, it could get even more expensive because 15 million will then grow, and those people end up at hospital doorsteps at their most expensive and worst health care crises times.
Yeah, I think it's very simple, actually. When you hear people in this country complaining about health care or wanting things to be fixed, what they're talking about is coverage through the marketplaces or the exchanges. And absolutely those things do need to be fixed. And I think we could probably fix those in a bipartisan way. But what you are not hearing people talk about anywhere is the need or the desire to take $700 billion out of Medicaid, you know, kicking grandma out of a nursing home, stopping coverage for kids with disabilities, and quite frankly, blunting our efforts.
Republicans did that to Democrats. I mean, we all remember, remember the grandma hurtling toward the precipice commercial that's now being used for the other side. But we can put up the senators right now, the GOP senators who are against it, and Rob Portman and Susan Collins, Ohio, Maine, are both against it because they're concerned about their constituents who will lose the Medicaid benefits. But if it goes to the states and gives them the choice, why can they then not just simply figure out a way to take it onto their budget? I mean, why is this a federal government issue at this point?
Well, I think things like the fact that the nation's long-term care system is Medicaid. The nation's mental health system is Medicaid. It is a national issue. These are national problems that we are trying to solve. And if anybody thinks that states can turn around and backfill $700 billion worth of care either by raising taxes or by gutting education, they just honestly haven't been paying attention to what's happening in state capitals over the past decade.
Okay. We appreciate you being here. It's timing, very important that we do get reaction, certainly from the Medicaid establishment, I guess you could say. Matt Salo, National Association of Medicaid Directors, thank you so much for joining us.